Good afternoon. My name is Kayla Peters. I am the Outreach and Event Coordinator here at the Kensington Falls Church. On behalf of the Kensington, we thank you for sharing your time with us this afternoon. The Kensington Falls Church is an assisted living and memory care residence located in the heart of Falls Church, Virginia. Our enhanced programs enable us to deliver care beyond what the traditional senior living community can deliver. We are open for tours by appointment, so please visit our website. We look forward to listening to your needs. Now, let us review a few housekeeping rules for this afternoon. We are using Zoom webinar format, so your videos and microphones will be off. There will be slides shown during the presentation, so feel free to click the view button for different viewing options. If you have any questions throughout the presentation, please use the Q&A feature to submit them, or the chat feature, which we will read to our speaker during the Q&A portions of the presentation, which there will be two of. Now, I'd like to introduce our speaker for this afternoon. We are fortunate to be hearing from Medicare licensed insurance consultant, Kevin Chaikin. Kevin is a member of Medicare Portal, an insurance agency focused on the education and enrollment of individuals into Medicare, which was inspired by his own family member's frustrating experience with Medicare. Kevin committed himself to helping others avoid the stress and costly mistakes that can be experienced when navigating Medicare alone. Please join me in welcoming Kevin Chaikin.
Kayla, thank you very much. I appreciate it. It's good to be here, and thank you to all of you who are attending. We're always initially trying to do this in person, and actually, obviously, we're still dealing with COVID and everything. I think it worked out a little bit better today. Anyway, I'm a little under the weather, so if you see me chewing on the halls or sniffling a little bit, I'll be fine. Just please bear with me. And this way, since you're on Zoom, I can't really call you out if you fall asleep during Medicare conversation, which can happen sometimes because this stuff is not really the most exciting, but it is important. And if you're here, obviously, you may have questions for yourself or your family member or members, and we want to make sure that we get as much information to you as possible in an efficient way and be able to answer any questions. So I'm going to go ahead and get the presentation started here, and I look forward to engaging with you all in a little bit. We won't take too long. We definitely want to make sure that we don't take up your whole day with Medicare, but we'll get through this and see what kind of questions we have. So let's see if I can figure out Zoom. Here we go. Okay, excuse me. So as Kayla mentioned, my name is Kevin Chaikin. I'm with Medicare Portal, and today we're going to cover a few topics. Primarily, though, we're going to start here with the Medicare annual enrollment period. Things that you need to know. We're already underway here, which we'll get into here in a minute. So this is not like something to prepare for. We're there. So we want to make sure that if you do need to use this enrollment period for your Medicare needs, then you're able to do so. This is just kind of, I think, how we all feel dealing with Medicare. If I was in a room with you right now, and you can just answer silently, but are you getting any phone calls or seeing any ridiculous TV advertisements for Medicare plans? I'm sure you are. It's very frustrating, and we understand that, and it's misleading a lot of times. So we want to try to clear up some of that confusion because it does really kind of cloud the entire experience, and you're not really sure what to think. Sometimes what questions to ask. So hopefully this will help out a little bit. So again, Medicare Portal, just a brief understanding of who we are. So we are a local organization here based out of the Tysons Corner area. We do serve the entire Mid-Atlantic and many states throughout the country, but we're really based here in the Northern Virginia area. And we are independent Medicare brokers, right? So we're an agency that provides no-cost education, enrollment, and lifetime support to both current and future Medicare beneficiaries. This means if you need help with enrollment into Medicare when you're first eligible, we can help you with that. Okay, that means if you need to look into supplemental options, prescription options, Medicare Advantage options when you're first eligible, or when you're already on Medicare, like some of you may be right now, we do that all for you, and that comes at no cost. And we'll explain a little bit later, but basically what happens, just like most insurance agents, is we're going to find the plan options that best suit you. And as independent brokers, we do work with all the insurance companies, so we can find plans that fit your needs, not make you fit a certain plan. And the plan that you ultimately choose will pay us, so you don't have to worry about that. And we help with enrollment and offer lifetime service. So for those of you that are here at the Kensington or nearby, we are local. For those in Northern Virginia, I did mention, of course, we're no cost for any of our services. So if you have a premium for your plan that you need to go on, then you'll pay the exact same amount going through the insurance company as you will through us. And again, I do want to highlight the unbiased part. We're objective in this. Okay, we're your partners here. We understand Medicare is confusing. Everyone has unique needs. So I can't take one plan and say that everyone here today needs to be on it, right? It's great for one person. It may not be right for the next. So we need to understand your prescription needs, your doctor's needs, your health needs, your financial goals and needs, and then we'll be able to make recommendations based off that. I am not multilingual, but we do have some folks in the organization as well if you need someone else to speak something other than English. So what we'll cover today in this section here is just what is the annual enrollment period. All right, this is the time where, of course, you're seeing all the advertisements here and everything, because this is when, of course, there's a lot of money being spent by the insurance companies to advertise this. This is the biggest opportunity to make changes to your Medicare. Talk about what you can change with your Medicare, where to find the changes, and what benefit changes you can actually make during AEP, and then a little bit more about how we can play a role in the process. Although I did kind of address that a little bit, I'm not going to belabor that point, but we will finish with that, and we'll break after that for some questions and then go into a little bit more information. So what is the annual enrollment period? There are several enrollment periods throughout the year. Annual enrollment, though, again, being the biggest one where you can make the most changes to your coverage. So let's look at this here. You can make the enrollment period began on October 15th and it ends on December 7th. So right now we have just under a month to make the changes that you need to make to become effective on January 1st. Any change you make to your Part C and D Medicare plans becomes effective on January 1st of 2022 in this case. So there's still time. Don't panic. You don't have to rush, but we are running out of time. Certainly, if you are looking to get a review done, make a change. So if you do intend to do that, make sure you set up some time with a broker or ourselves. We're happy to help. And then what you can actually adjust is Part C and D. Part C is also known as Medicare Advantage. Part D is your prescription drug coverage. You don't need to do anything with Parts A and B, by the way. I sometimes get questions about, well, do I need to renew Medicare, or what if I have a supplement? Do I need to do anything with that? No, those things are going to continue carrying over just as they are. And by the way, if you have a Part C or D plan that you're happy with and you've had a review or you've done the review yourself, then you don't have to do anything necessarily either for that to carry over, as long as that plan is available next year. And most of them in this area are going to be available. So what can change with your plans each year? So what you should be looking for, already have found, is, all parts of Medicare really can change. Premiums, co-payments, and deductibles being big parts. Now, Parts A and B of Medicare, which are through the government, Part A is hospital, Part B is medical. Those dollar amounts that change for next year have not been released yet. So we should get that information very soon, like by the end of this month. But you can imagine that you're probably going to see some increases in things like the Part B premium, deductible, Part A deductibles. So just be on the lookout for that, and we'll address that once that information is out. With Part C and D, you'll also see changes in things like deductibles, co-payments, premiums, as well as the formulary or the drug lists, right? So in your prescription plan, the actual tier that determines the cost of your prescriptions could change. You might have a drug that is no longer on a formulary. I've had that happen to my own mom before, where we had to go ahead and find a new plan, and we were able to do that, but the drug she needed was dropped. Plans network providers. If you're on a Medicare Advantage plan, that can change every year, right? So don't just assume if you're in one of these plans that all your doctors are still covered. All right. I'm not saying it's likely that they will leave the plan, but it's possible. And then ultimately, service areas can change, or if you moved service areas, there are changes that you need to look for. How do you find this out? And if your plan is changing. So this is something that is really should, if you're on a C or D plan, which pretty much anyone in Medicare is going to have one or the other, then you should have already received an annual notice of change, or an ANOC, as you can see here. Now, this should have come in September. If you didn't get it, maybe you missed it, but you need to understand what has changed with, again, those co-payments, all the costs, the coverage. And if you haven't received this yet or reviewed it, time to ask the insurance company for it or review it if it's sitting on your desk, or again, let us know. We'll help you understand some of the changes in the annual notice of change. But should have gotten that in September, and it does outline any changes to your benefits for the upcoming year. So we've the other thing to be on the lookout for is your maximum out-of-pocket changes. So we've already talked about these other four here: the deductibles, premiums, co-payments, and co-insurance. But your max out-of-pocket may change if you're on a Medicare Advantage plan. Unfortunately, there is still no maximum out-of-pocket on Medicare prescription coverage or original Medicare. Those things do not exist. That's why it's important to shop your drug plans correctly. It's important to have some kind of supplemental coverage to parts A and B because there is no limit. So you want to minimize your expenses, of course, as much as possible without compromising your coverage, which is ultimately our goal, helping you out. So what changes can you make during annual enrollment? Well, it's pretty simple. These are all kind of a combination of each other, right? So if you're in a Medicare Advantage Part C plan today, and you find that there's one that maybe reduces your out-of-pocket costs, reduces your co-pays, maybe the drug coverage is better, or you like the extra benefits more, you can switch to a different Medicare Advantage plan for next year. You could also go from original Medicare. Let's say you have a Medicare Supplement to your original Medicare, Plan G or F or N, and you may decide that you no longer want to pay those premiums that are increasing every year. You may go ahead and drop that and decide to go Medicare Advantage, or vice versa. You may decide that you've tried Medicare Advantage, you want to go back to original Medicare. You can change your prescription drug plan. That's probably the most common thing that happens this time of year, are those drug reviews. And we're seeing certain plans that are having significant increases in premium year over year, and there are some that are dropping. But those, a lot of times if you have a drug plan and the premiums are increasing 2 to 3 times, there may not be a reason that you need to necessarily pay that, because you may not need that plan anymore to best suit your drug needs. So that's why this review is very important, so you're not overpaying for prescriptions, because this prescription over here is going to treat you the exact same as it would over here on a different plan and maybe not cost you as much. You could also enroll into Part D if you don't have a prescription plan, and then also you could just opt out of it completely. Wouldn't necessarily advise that unless you have a solution to cover, like either Medicare Advantage, or maybe you have some kind of employer or retiree or union or VA benefit type coverage. Additionally, it's important to note, December 7th is the end of the annual enrollment period. However, if you're in a Medicare Advantage plan, you also get an open enrollment period in the first quarter. So from January 1st to March 31st, there's a one-time opportunity, or it's an opportunity to make a one-time plan change. Okay, whether you do that in January, February, or March, the plan will go into effect the first of the following month. This would be for those already on Medicare Advantage. If you're in original Medicare and then you decide that you want to go Medicare Advantage, I'm sorry, but you can't do that then, unless you have some kind of special enrollment period. You'll have to wait until the annual enrollment period the following year. The reason that this exists, I think there's a couple of reasons, but one is your situation could change, right? If we enroll in a plan today together, it starts January 1st, and then in February, you have a new diagnosis, or you are off of certain drugs or put on certain drugs, you have certain new needs. That may change how your coverage is obviously affecting you and helping you, and you may make a change that could benefit you, right? So you're allowed to change, maybe your situation has changed. The other problem, I think, goes back to what we're talking about earlier, what I mentioned earlier about all these advertisements, right? And unfortunately, a lot of misleading television commercials promising you that you're going to get all your premium back for Part B, or that you're going to get everything else for free, or, thousands of dollars worth of dental. Again, those are misleading advertisements. I'm not saying that there's not some truth in there, but let's cut through that and understand what's really available to you. Because a lot of these plans, specifically Medicare Advantage, are really going to be specific to your county or your zip code where you're at, not just nationally, right? So that's an important opportunity. You have a right to change back in case you're taking, in case you buy into one of these options that maybe turns out to not be so good. And unfortunately, that's the reality. There are people out there always trying to take advantage. We're trying to obviously, not see that happen, be able to help you out and avoid those circumstances. So how can we play a role in this? I'm just going to cover that again real quick. And and then we'll stop for a minute for questions and everything, and then go into a little bit more information. So I mentioned the annual notice of change. If you've received it, you don't understand it, or quite frankly, anything from your insurance company that is just, you get a lot of paperwork sometimes, right? We're happy to help read through that, identify changes, and understand things about your plan, as well as your Medicare rights. Medicare rights are important. That's why we talk about the open enrollment period. You have a right to change if you're in the wrong plan when you start the year. So we want to make sure you're always aware of that. Changes to Medicare happen. We want to keep you informed. So conducting a review of your current plan. Obviously, right now we're helping a lot of new folks who are not yet clients of ours, help them with their reviews and getting them new plans, or helping them decide to stay in their current. But obviously, those who are already working with us, we're also doing annual reviews. So that could be reviews of prescription coverage, drug coverage, all your medical benefits, making sure that by December 7th and effective for January 1st, you have exactly what you need. I mean, there's no perfect insurance solution, but the best possible for your scenario. And excuse me, confirming current doctors in the network if you have an Advantage plan, going through plan options available to you, because there are certainly dozens when you look at prescription options and Medicare Advantage, and then ensuring that ultimately your financial goals and medical needs are met through your plan. We want to provide you, make sure you have comprehensive and cost-effective coverage. There is a way to do both, and that's ultimately we want to get as close to that as possible. So just some final thoughts, and then we'll open it up for questions. It's never too early. Now, it's not really early anymore. Obviously, we're in the middle of the annual enrollment period, so now is better than later. But it's never too early, even if you're into next year and it's June, and perhaps you just are curious of what's going to be available next year. You can start looking at some other plans that are, currently in 2022 that may have some features that you like, that you want to look for if they're available in 2023, or understanding what certain things about Medicare are. Just do your research and start early. That's okay. Or if you're new to Medicare or going to be soon, I will always help anybody who's close, within even a few years. I mean, I can't help you with coverage yet or help you enroll yet, but you may have questions at 60, 62, 64, or you might be retiring at 70, 75, new to Medicare. Start early, understand all your options, ask questions. This last thing is important. It's kind of cliche, right? There are no dumb questions, but really in Medicare, I've never heard a dumb question. And I hear all the time people tell me that, I really feel and believe that I am a smart person. I'm educated. I know that I'm intelligent, but I just can't fully wrap my head around this Medicare stuff. It's confusing. And the unfortunate reality is that it is confusing. And sometimes it seems unnecessarily confusing, but that's what we're here to do, is to try to cut through that and make things a little more clear for you so that you can feel confident in your Medicare coverage, any changes that you may or may not need moving forward. And we'll be there to do that for you every year so that you're not left on your own, for the rest of your life, because this is ultimately the last health insurance that you're going to be on, but you can make adjustments as needed as you age. So I'm going to grab a sip of water and see if we have any questions.
Great. So yes, we do have a few questions that came through that you touched on a little bit, but so someone who is currently self-pay for their medical insurance, they're turning 65 in June of 2022, so right in the middle of the year. When would they need to register for Medicare?
Great question. So June, you're going to start registering for Medicare in March. So, and I'm going to cover this actually on the next slides, but your initial enrollment period is the 3 months prior to your birth month, including the month you turn 65 and the 3 months following. So it's a 7-month window. And so if you want that to start on June 1st, for instance, then you could start applying for Medicare Parts A and B March 1st. And then we can, you start looking at the supplemental plans and the other options once you get that application in. If your birthday's on June 1st, then actually you would start a month earlier, by the way, and that would be February with benefits actually able to start May 1st.
Okay, great. Thank you. And this you did touch on a little bit in your last slide there, but for people who are maybe not ready just yet for Medicare, but they want to stay on top of things and prepare, what are some tips? I know you said do your research, maybe reaching out to brokers, someone like you. So what are some tips for people who aren't ready yet, but want to start preparing?
Sure. Yeah. So I think definitely and I'm saying this, there's of course a reason self-serving to reach out to me, but I don't mean like just reach out to me. I think that when you're trying to find a broker, you should talk to a few, right? I
Mhm.
mean, everyone who's a good broker, which means they put you first. Everyone has a different style and stuff. We're all going to be no cost to you, or we should be, and should have access to all the same plans, or that you're going to pay the same thing on. But find what fits your style, your personality. Who do you feel comfortable with? At the end of the day, this is not just, hey, let me help you when you turn 65, and then good luck to you the rest of your life. This is going to be a relationship that you'll probably keep the rest of your life, right? So talk to multiple people. Don't just say, oh, I want this person. I think understanding your rights. Now, this is something we would go into, and I'll talk about it again in a little bit. But when you're first eligible for Medicare, when you're new to it, whether you're at 65 or you retire past 65 and you enroll in Medicare Part B later, you have certain rights at that time also when it comes to like supplemental plans and guaranteed issue, and where you may be denied certain plan options later in life. Important to understand your rights, right? So really thinking about not just, what's the cost today and what sounds good today, but if something happens down the road, what's going to be the best scenario for me? What if I can't get into a certain plan? So again, that's done through research, and we go over that stuff together. But understanding your rights, that because your big decision, I'm kind of going into the next part here, but when you are first going on Medicare, you've made that decision, and it may not be a decision. You may be just in a situation you have to go on it at 65 or when you retire, but you're going to choose one of two ways to get your coverage through original Medicare or Medicare Advantage. And I'll talk about in a minute other things to consider, but that's really, in my opinion, the biggest thing you have to think about. Okay, because finding a plan once you make that decision is not all that difficult, and that's certainly our job to help you with that, right? Is to narrow things down to the ones that cover your prescription needs, meet your financial needs and goals, cover your doctor's medical needs. So we're not looking at 30 plans and just trying to pick one. We're going to narrow that down to a few. So that big decision, which I'll touch on in a moment,
Mhm.
is probably the biggest thing when you're preparing to think about.
Great. Perfect. Well, I
And
think,
leaving yourself, and I apologize, and leaving
yeah.
yourself enough time. So whether you're turning 65 and enrolling, or you're enrolling past 65 later, again, I would start the process, 4 to 6 months. Be prepared at least 3 months to start enrolling, even if you're still employed, because there's paperwork you have to get from your employer as
Mhm.
well when you're in that scenario, if you're retiring past 65. So just make sure you're ahead of the game.
Great. Perfect. Well, that is great. I think we can continue moving forward. And then if we have any questions later on in the chat, we'll stop again for questions, but we can move forward.
Okay. So go ahead and share a new screen. Can you see the blue one with my picture on it?
Yes.
Okay. So this is just a little bit more about Medicare coverage, Medicare Advantage. We'll talk about a little bit more here because, as I mentioned in the last section, this is one of the things that you would potentially do during annual enrollment is Medicare Advantage, and it's important to understand because it's kind of a confusing topic, and really, how does this work, right? You see a ton of advertising for it, but what are you getting? How do you make this decision? And I also just want to state very briefly here that this does say United Healthcare. We just really feel strongly about their materials. They have some good presentations and educational materials. So there's no plan information in here for them. I'm not in any way, shape, or form suggesting that that's who you should do business with. Again, I would not recommend any company or any plan until we know what your goals and needs are. So just keep that in mind, but they do have some pretty solid materials. So again, we're talking about Medicare Advantage in a little more detail today. You already know who I am. So we're going to cover a few things on here. Again, I'm not going to go through all of it. We've touched on some of it so far, but since, of course, it sounds like some of you are not yet on Medicare, understand your choices and enrollment. Talk a little bit about Medicare Advantage and the prescription drug coverage. Okay. So for those of you already on it, you have this card, right? Red, white, and blue covers parts A and B. Part A is hospital, part B is medical. Part A is free for most people, or $0 a month. You've paid into this your whole life. Part B, you will have a premium. Okay, this year the base rate is $148.50. Next year's base premium has not been released yet. Excuse me. And then you could have potentially income related adjustments for Part B if you, based on your income, and if you enroll late, you could have late enrollment penalties. So, part of this is understanding your eligibility and when you should enroll. And we'll talk about that as well, since again, it sounds like some of you are not yet 65 or on Medicare. Now, this step 2, once you've got the application to Medicare done, probably before then you should be thinking about this, but this is the choice I was talking about. You have 2 options. All right, now option 1 is original Medicare, so that red, white, and blue card. And then we recommend adding a Medicare supplement on top of it. So why do we recommend that? Well, if you're on original Medicare by itself and you go to the hospital, okay, there's a deductible. That deductible this year is $1,484, whether you're admitted for a day or 60 days. Okay, if you're there for more than 60 days, there are copays that start every day. If you are in the emergency room, which is covered under Part B, there's a deductible for the year of $203 this year. That will go up next year, I'm sure. But then you pay 20%, and there is no out-of-pocket limit. So even though Medicare does limit what the cost, what a provider can charge you for each of these things, they can just keep stacking on top of each other. So I want to be able to, of course, prevent limit the exposure out of pocket. So a supplement's going to help pay a lot of those out-of-pocket costs. And then in addition to that, that's all that is a secondary private payer to Medicare. So you don't get drug coverage with that. You don't get dental, vision, and hearing with that. So Medicare Part D, you have to buy purchase separately from a private plan through an insurance company. And then if you wanted dental, vision, and hearing, you'd purchase that separately. So it's possible you could have, your Medicare card, your supplement card, a prescription drug card, and then maybe a dental, vision, and or hearing card, maybe 4 or more policies to cover all these things. That's a premium for everything. Okay. And that's not necessarily a bad thing, because you are limiting your out-of-pocket expenses. And on original Medicare, you can see any doctor in the country who takes Medicare. So it is pretty flexible. Option 2 is a Medicare Advantage plan. That's also called Part C. Now, it's not the official acronym for Part C, but I like to think of the C as that it stands for combines, because it does. It combines everything. So these plans are offered by private companies after Medicare kind of sets the parameters. And then now that insurance company is going to offer your benefits from Parts A and B. So you actually are not using the red, white, and blue card when you're on a Medicare Advantage plan. You don't lose that, but it's now going to all be administered by the insurance company who's giving you these benefits. Okay. Medicare is actually paying a flat rate to the insurance company to manage your Medicare benefits. And so they offer A and B, combine that typically with drug coverage from Part D. And then they'll include a lot of those extra benefits that original Medicare does not cover, like the dental, basic vision, hearing, maybe transportation, gym memberships, over the counter, all those sorts of things. So they're pretty benefit rich, but they also are have a little bit higher exposure. So over here in option 1, you're paying more up front with very limited out-of-pocket costs on the medical side. On option 2, you're paying little to nothing extra up front with, pay as you go model. So it is a little bit more risk-based in the sense that your exposure could be higher, not always, depends on what you're paying and how old you are on option 1, but you could end up, paying more out of pocket with option 2. They also are network-based plans. So with PPOs and HMOs, even in a PPO, which allows you flexibility, PPO is still a preferred provider organization. It's a network. You just may have flexibility to go outside of it by paying a little bit more. So for those of you that are not yet on Medicare, Medicare is a federal program. You have to be at least 65 years old, or you're under 65 with a qualifying disability or other situation, end-stage renal disease, kidney dialysis, or ALS. You also have to be a citizen here in the U.S. or a legal resident for 5, who's lived here for 5 consecutive years. So if you meet those eligibility requirements, then your initial enrollment period. So going back to one of those questions earlier, it's the 7-month period surrounding your 65th birth month. So again, if your June 15th birthday, March 1st it starts, and the last day you can enroll in Medicare would be, July, August, September 30th. understanding that if you apply like the month of your birthday, that will start the following month. If you apply any of the months following your birth month, you will then see delays of 2 to 3 months in coverage, which can create lapses in coverage. Okay, you're not going to be penalized because you're still during your initial enrollment period, but you may have a lapse in coverage. So unless you have something to tie you over, I always recommend applying before your birth month so it can start the month of your 65th birthday if you're going to go fully onto Medicare. And some people just go into Part A. Okay, if you're working still and you work for a larger employer and you're not contributing to an HSA, a health savings account, a lot of times folks will take Part A because it doesn't cost anything extra per month, and it's nice to have secondary hospital insurance. So you could do both or one or the other. You can also get a Medicare Advantage plan or prescription drug plan at that time, and also understand that just like with Part B late enrollment, if you don't have creditable coverage, if you do not have creditable Part D prescription coverage, you will also pay a penalty. So how does that look? Well, most employer plans may be considered creditable unless you're with a small employer maybe under 20 employees, where you might run into Medicare not considering that creditable, or it could be some kind of other prescription drug coverage. You should always check with your employer if you have it, or whomever is administering those benefits, to understand if they are deemed creditable by Medicare, which means basically they're as good as or better than Medicare's prescription drug coverage. Otherwise, you will potentially face a penalty. And we can help you understand that, but always recommend talking to the employer or the administrator to confirm. Now, eligibility and enrollment periods. We just talked about AEP, or annual enrollment, so I'm not going to keep hammering on that. But obviously, if this applies to you, you should be doing something now, even if it's just reviewing and ensuring what you have is right. Talked about open enrollment here, January 1st to March 31st. That's for anyone on a Medicare Advantage plan, not on original Medicare. Now, you may have special enrollment periods throughout the year. If you are working past 65, you can apply for Medicare anytime while you're still enrolled. Generally, would say if you don't want to start anytime soon, just wait, right? But you could do 3 months, let's say, prior to the day you want it to start, or your retirement, start enrolling in Part B. Excuse me, or both parts of Medicare. You can do that anytime, and up to 8 months after you leave the employer, but then you may have a gap in coverage. So, timing that correctly is also important. And then other reasons you may have a special enrollment period. Well, again, we talked about retiring. If you move, okay, maybe you have an Advantage plan and you move, or you just moved here to the Kensington, right? You may have a special enrollment period that you could actually change your coverage. If you qualify for extra help, which is a federal program through the Social Security Administration that helps to subsidize the cost of Part D prescription premiums and Part D prescription copayments, that would also give you potentially other special enrollment periods throughout the year. Or if you have certain chronic health conditions, there are certain plans that cover those things. Depends on where you live for those, but that may also give you a special enrollment period. And there are several other reasons. These are just some of the most common. Excuse me. I'm going to take a sip of water. I did tell you I was sick. I can't help it. I'm sorry. So that was good. So Medicare Advantage, again, there's no perfect solution. Just like I said, I'm not here to, just because there's a United Healthcare logo somewhere here, to say that that's what's best for you. I'm also not suggesting that Medicare Advantage is best for any of you. It's right for some, not all. Original Medicare, the supplement, is right for some, not all. It all depends on your situation, but they both have pros and cons. So some of the benefits of Advantage are going to be not so much how many people are on it. That's not such a huge deal, but the satisfaction for those 27 million, right, is pretty high. So one thing you do get with Advantage plans is, the insurance company is far more involved in your benefits and your care than the government is, right? If you go on original Medicare, and they basically are processing claims and administering the benefits, they're not necessarily concerned about your health. An Advantage plan has a financial incentive to keep you healthy. So, they are more involved helping you utilize benefits, maybe making you aware of things you didn't even know were benefits you didn't even know existed on your plan. And, generally, again, not perfect. That's not 100% by any means. So 7% of 27 million is a lot of people, but generally pretty happy. And a lot of that has to do also with less spent, right? So the healthier you are, if you're using those preventative benefits, and you're already not maybe paying anything up front on a Medicare Advantage plan. Some of these plans are $0 a month. And remember, I said the government is paying a fee to the insurance company, that's how they offer them at zero, then your upfront cost could be a lot lower and you're only paying as you use it. So the healthier you are, obviously, the less you are using your benefits. So some people do get concerned, of course, that is Medicare Advantage going to cover everything that Medicare does? Well, it has to cover the same hospital stays, medical care, doctor's visits, vaccines that are covered under Part B. You still are dealing with insurance. There could be things like prior authorization, but that can delay things, but you're still covered under these things from Parts A and B. Additionally, that Advantage plan is going to typically include drug coverage, routine vision coverage. By the way, I don't mean like you have cataracts or glaucoma. That's a medical diagnosis that's covered under Medicare. This vision coverage is more for things like glasses and getting your vision checked. Routine hearing exams, hearing aid coverage, dental coverage, and then of course the out-of-pocket costs. Now over here on Original Medicare, we obviously look to get you protected from no out-of-pocket limit because we want to help with the supplement. But here there is an actual dollar limit that will be printed on that plan. Excuse me. So I'm not going to read through all 10 of these. By the way, I'm happy to send this material out if anybody wants it. So please feel free to email me. I'll make sure my contact information is up here at the end. But you may, you have to understand, number one, I think is the most important thing. That's why it's listed there, I suppose, is, the $0 Medicare Advantage premium sounds wonderful. Who wouldn't want to pay $0 a month for health insurance? And that is great. However, that doesn't mean you get to stop paying your Part B premium. So that $148.50 that most people are paying this year, you stop paying that, you're going to lose Part B, and then you're going to lose Medicare Advantage. So you have to keep paying that. It is not free. If you are on other coverage, joining a Medicare Advantage plan may affect that. It could be employer coverage, retiree coverage. It could be a prescription drug plan or a supplement. Okay, understand how this impacts it. If you're on a Medicare supplement and you think that joining an Advantage plan is going to add to your benefits, it will not. It will simply replace Original Medicare, and therefore it will make your supplement useless. You'll be paying a premium for nothing because Medicare has to be billed first with the supplement. So understand how that affects it. Or if you have a drug plan or another Medicare Advantage plan, joining an Advantage plan is probably going to automatically kick that plan out and you will lose it. So it's important to understand that. Again, this is where we will help you definitely know what to expect, but don't, and you can do this on your own, obviously, but don't be caught off guard. We mentioned this earlier, but in Advantage, it is more similar to what we're used to, like with an employer plan. Okay, you're going to have HMOs and PPOs where there are networks, and it's best to use your network for the best cost sharing, especially on an HMO. But even on a PPO, you're going to pay a little bit more out of network. Talked about extra help and financial assistance. That's your specific situation. We can go into that more in detail together. We talked about Part D late enrollment penalties that can exist for Parts B and D. So understand, make sure you're covered correctly. I kind of alluded to this, but a supplement, otherwise called a Medigap policy, is not Advantage. So some people say I have a supplement, and then we start talking and they pay no premium. They just pay as they go, and that has dental, vision, and hearing. That's an Advantage plan, not a supplement. You cannot have both. Okay. If someone sells you a supplement and you're on Medicare Advantage and they're just telling you it's going to work with it, they're really not even allowed to do that. Right. So you have to have one or the other. You have to choose. You can change your decision, right, later if you choose one when you first start Medicare. It's not that you are stuck with that forever necessarily, but they're not the same thing. They don't operate at all together. Your member ID, important to note, that's everything. Okay. If you're on a Medicare Advantage plan, that is where you get all your benefits. So doctor, ER, labs, hospital, skilled nursing, dentist, pharmacy. Okay. That card is going to be your medical passport, so to speak, what you will use. And that's because that's what's being billed. We talked about how Medicare covers the same things as Medicare. I'm sorry, Advantage is the same thing as Medicare, and then that out-of-pocket maximum. Okay. Now this is the last kind of part here, and then we'll open it back up for questions, and then we'll be done. I do appreciate everyone's patience and questions so far. I see we have a couple more, I think. So looking forward to answering those. But prescription drug coverage, my goodness, this is like the most annoying, frustrating part about Medicare, in my opinion. I've been doing this for several years now, and it probably took me longer to learn about this than anything else because it is confusing. And it's kind of scary, right? We all know the cost of pharmaceuticals is, it's on the rise, it's expensive. We've all heard horror stories about, just excessive costs of prescriptions with no end in sight. And it is true. There is still no out-of-pocket limit on prescription drugs. So you will pay forever, well, for the rest of the year, even if you hit a certain amount. Okay. There's also no negotiated drug prices at this point on Medicare drug costs. So, there's a lot of variation. So there are 4 calendar stages of drug coverage, these payment stages. Okay. And I'm going to break those down for you a little bit here. So there's a deductible. Now, the deductible for 2022, now that's set by Medicare. That's the maximum that a plan can have as a set deductible. Okay. It's $480. Now, your plan might have a $0 deductible. It can be anywhere in between, basically 0 to 480, and usually applies to higher tier drugs like tiers 3, 4, and 5. And in those tiers, if you have a deductible, you'll pay 100% of the cost of your drugs until you meet the deductible, at which point, and then at that point, so far, the plan has paid nothing. And then once you hit it, you go into the initial coverage phase or stage. So initial coverage is where you're paying a fixed copay or coinsurance. Okay, and I'll show you here, and I'll come back to this, but every drug list, the formulary has tiers. Okay, tier 1 is preferred generic, tier 2 is generic, tier 3 preferred brand, non-preferred, and specialty. Okay, as you can imagine, preferred generics are going to be your generic and common low-cost drugs, right? The higher the tier, the rarer and likely there's not a generic version, and more expensive they become. So the companies are going to have fixed copay for tier 1, a fixed copay for tier 2, maybe a copay or coinsurance tier 3, typically a percentage coinsurance on tiers 4 and 5. You will pay whatever that is for the plan in the initial coverage stage. The plan will pay the balance until your total drug costs reach $4,430. Excuse me, $4,430. That is not your out-of-pocket costs. Certainly a portion of it is, but the total cost that you and the plan pay together. So think of it as the retail cost. If you reach that amount, and not everybody will, but if you do, then you go into the coverage gap or the donut hole. That's where you pay 25%. This is what everyone is scared about. They're worried about the donut hole. A lot of you, or many of you, may not even hit that. We figure this out before we get into a plan. Obviously, your situation can change during the year, but you shouldn't go into the year without knowing in your current situation whether or not you're going to hit it. But when you are there, 25% of the cost of your drugs, no matter if that drug is $1 or $1,000 or $5,000. Okay, the plan will pay a percentage. Right, it's pretty massive difference, 5 to 75%. Right, so they're usually paying 75% on generic drugs. The drug manufacturer will pick up a portion of it for those drugs that are covered between 5 and 75%. Right, and then your total out-of-pocket costs, when that reaches $7,050, then you go into catastrophic coverage. Now, $7,050 is also not necessarily your cost out of pocket. It's going to be your cost and the drug manufacturer. Okay, for some of these brand name drugs, you're going to get some of that subsidized by the drug manufacturer. If you hit that amount, you go to catastrophic coverage where you remain for the rest of the year. Then you pay a copay. It's either $395 for generics, $995 for others, and then or a 5% coinsurance. Of course, how this is put together, it's whichever is greater. Go figure. You'll pay that. The plan pays 15%. The rest gets subsidized by Medicare, and you stay there to the end of the year. So, like I said, there's no out-of-pocket limit. So you're not getting out of catastrophic coverage until January 1st when this all resets. Okay, and hopefully you found a plan the following year that may serve you a little bit better. But since these numbers are set by Medicare, especially here, these are retail costs. Most plans, it's just your retail cost is going to be calculated very much the same. So you're going to go into the coverage gap, around the same time. This, of course, can vary because of what your costs are on the plan. So I just talked about these two things. Not going to, keep going into the same stuff. I don't want to bore you to death. Pharmacies, you can pretty much go to almost all pharmacies. There are out of network, but for the most part, you will find most pharmacies in network, but understanding that there are not only in-network retailers, but actually preferred versus standard. So we don't just look at the drug costs. We are going to also look at your pharmacy. If you like to go to this local pharmacy, the pharmacist, or you like CVS or Walgreens or whatever, and you prefer to keep that, then we need to take that into consideration. Also, if you like mail order or want to try, you'll be rewarded typically, because for those that can fill those prescriptions that can be filled for 90 days, you can typically go mail order and save money that way as well. Talked about the formulary and the drug tiers. There's something called step therapy. If you get prescribed an expensive drug, it's possible that, and this says United Healthcare again, this is just whatever your plan is, can help you save money on those prescriptions by offering a lower cost variation of that drug that treats the condition that you are being treated for on your way up back to that drug, right? So that you maybe start with something lower cost and step up so that you're not going right into maybe a brand name drug. But everyone's body reacts differently. So, you don't know necessarily if a generic is going to work for you. There are quantity limits on certain types of drugs. For instance, opioids, of course, would be an obvious one, right? They're going to limit the amount you can get. Probably can't get 90-day supply on some of those things. And then prior authorization. So sometimes you'll go on a plan and everything's covered, but then you still have to get the plan to authorize you to use it. Typically, they're trying to see that you've got a history with that prescription. Want to make sure that you are using it correctly. It may require you to use a different drug. Usually it's just to make sure like you've been using it and you're using it right. And if you need an exception, sometimes you'll be on a plan. Maybe there are certain drugs that no plan covers, or you're on a plan and then your situation changes mid-year and you cannot change your drug plan. And then you're prescribed a drug that is the only one that works for you for that condition, and it's not on the formulary. Well, you can have your doctor help to ask for a formulary exception, asking the plan to cover the drug. And the nice thing about that, first of all, your doctor should be very familiar with how this works, help you out with that, or the office. And then within 72 hours, the plan has to give you a decision. You're not waiting around for weeks. So you can get that answer pretty quickly. I already talked about this. I'm not going to keep telling you how I can help. Obviously, we are more than happy to do so. But ultimately, if you need it, you just let us know, and we are going to be here, for you. So I'm just going to focus on this. If you need my information, you will have it here. And that is it for the presentations. No more PowerPoints.
All right. So that was great. Thank you so much. I know that was a lot of information to digest. So we are open for questions. If anybody does have any further questions, you could submit them via the Q&A or the chat. I'll give people, a few seconds, see if they have any last minute questions coming through. I
want to address one thing that I see in the chat from M Street. So when it comes to someone telling you to look at, in this case, Anthem or any plan, okay, I'm not suggesting that person has no idea what they're talking about. Hopefully, though, that they are taking into consideration your situation, right? So if you live at the Kensington, right, there may be plans that work better with that. So that part is true, but still that doesn't cover your, all your doctors and necessarily your prescription needs. So I'm always very, really make sure to call out the fact that you should be cautious of just taking someone's advice, even if it's a very trusted friend or family member, about which plan is best. And this is for those of you in Kensington or not, right? Because what's right for one person, as I mentioned earlier, is not necessarily right for the other one. So I have dealt with people before and who are working with now, we've tried to correct things where they went on a plan that maybe their neighbor told them about, or even their spouse was on, okay? And it does not work for you, at least not as good as something else could. So it's really, that's why we offer an individualized approach, right? Because it's not a one size fits all. You really have to make sure you understand what you're getting into. The research is done. But yes, there could be certain plans that may be, as it's set up here, maybe more compatible with where you're living, in this case, Kensington. But again, that's, we can help you identify that.
Right. Perfect. Thank you. Thank you so much for touching on that. I will wait a few more moments for any other additional questions to come through. But in the meantime, I do just want to thank you, Kevin, for taking your time to be with us this afternoon and sharing such useful and helpful information. As we all know, Medicare and just insurance in general can be very, very confusing. So thank you so much. And I do want to take a moment to also wish everyone and their loved ones a happy Veterans Day if you are celebrating today. And This presentation is recorded. So for anybody who did register today, you will get an email with the recording of this, and it will be up on our website, hopefully by next week. So you can always refer back to it, you know, and as well as Kevin's information will be on here as well. And I will also leave up the holding slide from the beginning of the presentation with his information, again, in case anybody wanted to take anything down. But all right, so I think I don't see any more questions coming through. All right, so I am going to put back our holding slide up, but otherwise, Kevin, again, thank you so much for taking your time with us this afternoon. And I hope everybody, oh, wait. Okay, that was Mr. Street. He's gonna email you.
I'll look for the email. Thank you. And by the way, you're right. Thank you to any veterans or your families out there. Really appreciate your service. Thank you.
Great. Well, everyone, thank you so much for joining us this afternoon. And again, thank you, Kevin. I will put the holding slide back up for everyone's convenience. And I hope everyone has a great rest of the day. All right. Bye.